Hi, my name is Thomas Vogel. Today I'll be showing you how to bandage a wound. The victim today, he's conscious. He has a venous bleeding, which means it's bleeding from the vein. It's flowing and it's gushing, as you can see. And 5 things you need to do first, okay? First, you need to recognize that it's emergency. It's emergency.
Help,
It's
I've
pretty
fallen
easy.
and I can't get up.
There you go. First, you need to decide whether or not you need to help him, okay? I decided to help him because he's my brother, so I care about him, okay? Next, you need to decide whether or not to call 911. It's not that big of an emergency, so we're not going to call 911, but if he was bleeding profusely and he was unconscious, we would call 911. Okay, next you need to check the victim to make sure that the potential hazards, if there's like the object that cut him is still around. You need to see what caused it, like a knife. He's going through depression right now. He's currently staying at the house. And finally, you need to see how many victims are. There's only one victim. Okay, there are 3 stages of checking the victim. There's the primary stage, the secondary stage, and finally, the sample acronym stage, where you talk with people that observed it and see what he was doing leading up to the incident. For the primary check, you use the acronym RAP ABC. R standing for responsiveness, A standing for activate EMS, which in this case it's not that significant, so we're not going to call 911. P is the position of the victim. Just make sure he's in a comfortable position. If he's unconscious, make sure he's on his back and on a flat, rigid surface. Okay? For A, that's airway. Make sure he's breathing. He is breathing. He's alive. Next, for the B part of the acronym, you check his breathing to make sure he's alive. He is breathing. His airway is clear. If that's not the case, you have to do CPR, and there's a whole contingency plan in place if that's not the case. And finally, the C part of the acronym is circulation/breathing. In this case, he's responsive, so we know blood's flowing and he's breathing. As you can see, his chest is moving up and down, so he has good circulation and he is breathing. Well, his heart is pumping too. He's still alive. Next, we'll check the sample acronym. Final stage of assessing the victim is using the acronym SAMPLE. This occurs because you're trying to talk to bystanders, see what happened leading up to the incident, what medications he took, what he ate, stuff like that. Okay, so S stands for symptoms. A stands for any allergies that he might have, any food they might eat that might cause this incident to occur, which did not. M, any medications. P, any pertinent history, like any medical issues, anything like if he has hemophilia, bleeding problems and stuff. L, the last oral intake, what he ate leading up to this, if he consumed any alcohol, which will compromise his judgment, how he cut himself. And finally, E, events leading up to the illness. Okay, finally, we're going to bandage the wound. As you can see, there's venous bleeding occurring, which means it's occurring from a vein. In this instance, the blood will be flowing out steadily, or in some cases, it would be gushing. But as my sister told me, it occurs from arteries sometimes when it gushes. Okay, first we're going to expose the wound. As you can see, it's already exposed. We have already washed our hands and put our gloves on. If you want to learn how to do that in more detail, you can refer to the video before this. Next, we're going to put the bandage on it, applying pressure. We're going to hold it for 5 minutes to help the bleeding stop. Once we're done, after 5 minutes, we're going to wrap it in gauze. All this is sterile too, to make sure that there's no infection that will occur.
Sounds like toilet paper.
Okay, finally, you're going to wrap the cloth in gauze. Make sure you're applying enough pressure to ensure it doesn't continue bleeding. In this case, we don't need to call 911, we just need to closely monitor it to make sure it doesn't go into any shock and the bleeding does stop. After this is done, we will let this bandage stay on here for a few days, maybe 1 to 2 days, to make sure that the bleeding stops and the blood has sufficiently coagulated and has started healing. Once this is done, the victim will be happy and alive. As you can see, the victim has bandaged and he's alive. Everything is all right. Okay, now we need to dispose of the gloves and any used materials, okay? Once you take off the gloves, you're going to dispose it in a hazmat container and any of the used gauze to control the bleeding or any of the sterile cloths. Thank you.